And Dr. James R. Kimmy is with me, a Master of Public Health and an MD, and Professor Emeritus and Executive in Residence at the St. Louis University College for Public Health and Social Justice. Sir, welcome to the program.
Thanks so much, Tom. We're glad to be here.
What do you see as the biggest issues right now facing the Affordable Care Act and the implementation of it?
Well, I think the biggest issue is the implementation. We have the legislation, it's the law of the land. There are a lot of things that need to be done at the state level, at the community level, in order to make it really work. And it's critical to make it work because if we don't, there'll be a backsliding away from universality. And really, the Affordable Care Act should be a step toward universal coverage for everybody.
Right. Isn't a large part of that going to be informing people that starting in October they could sign up for this program and getting them on and with the program, and that for probably a significant portion of America, I hope it's not 47%, God forbid, they can get it for basically free, or there'll be government subsidies for them?
Well, there'll be government subsidies up to 400% of poverty. So,
right.
it's a good deal. The problem is, or one of the problems is, that there are kind of two kinds of people out there. There are people who, when they react to the Affordable Care Act, there are those who don't understand it, and that's most of the public, and there are those who don't want it to succeed, and that's a good part of the politicians. So you've got this dynamic of we really need to be informing the public. What they're getting, or they've been getting, is sort of a menu of slogans that are against the Affordable Care Act,
right,
and not a lot of facts about the things that are going to happen, and the things that already have happened, is with the kids up to 26 being covered under their parents, pre-existing conditions for children are gone. A lot of good things have happened, but they're not really getting communicated very well.
How do you respond to the Fox News message that they're careful to pound in literally every day or virtually every day, that once the Affordable Care Act goes into effect, employers will dump all their employees off. The employees will be able to pick up health care for $95 a month, the tax, the fee. If somebody gets sick, they can pick up insurance for the time that they're sick, and when they're not sick anymore, they can drop the insurance. And that's a messy free-for-all, and everybody's going to game the system.
Well, people try to game the system. I think there are many things built into the regulations that are coming out now around the Affordable Care Act that keep you from gaming the system in the ways that you've described. Certainly those are counterproductive. The idea that someone can go bare and then when they get sick get insurance, that's not going to wash. I just don't think, there's no insurer that's going to want to sell them insurance.
But it's legal, is it?
Well, but if they're coming in sick and they have refused to take insurance, I think that that's one of the things, and that will be adjusted over time. If that sort of thing happens, then there are going to be changes. The Affordable Care Act's not perfect. It's full of compromises, like most legislation that comes out of this town. And I think that over time, as we have with many other kinds of legislation, we're going to see adjustments made as people try to game the system.
Sure. For that $950 a year or $90 a month or whatever it is, that penalty that you pay, the tax that you pay if you choose not to have health insurance, do you get anything? Do you get any coverage? Are people covered, or are they just, It's
a penalty for refusing to take coverage. And, it's a financial penalty, but people that refuse to take coverage should really think about what they're doing in larger terms, community terms, not only their own health. But if they refuse coverage and end up going to the emergency room for their treatment, they are transferring their personal responsibility, of which Fox likes to talk a lot. They're transferring that personal responsibility to the community through insurance premiums for other people, through government programs. So, there's an element of personal responsibility in this that is responsibility to behave responsibly.
Right. I was in India once in the airport in Hyderabad, and there was some guy just coughing his guts out into a wastebasket, and about a quarter of the population there is infected with TB, some fairly large number. Only about 10% of them are contagious, but it was like a petri dish. It had, somebody had dropped a little bit of antibiotic on it. There was this perfect circle around this guy. Nobody would come closer than 50 feet to him. Everybody knew what was going on. Isn't that the sort of thing that happens in countries that don't have universal coverage? And isn't that why we should try to make that $950 a year penalty have some sort of basic coverage associated with it?
Things like that happen in this country. You don't have to go to countries that don't have coverage.
I know, because we don't have coverage.
It's not quite as dramatic as the 50-foot circle, but there are a lot of people who are out there not getting treatment because they don't have insurance that are spreading conditions, spreading disease. I mean, this how we can say that, even though we have the Affordable Care Act and we're going to cover, another 30-some million people, we're leaving 11 million uninsured, undocumented workers sitting out there. That is a public health issue,
right?
You see,
right. Setting aside the morality, it's a public health issue.
Yeah.
So what do we do about it?
Well, I think we have to, I think that's part of the adjustment I see going forward. We're going to have to cover people who represent a threat to the public health, not because they're threatening people, but because they're going to have conditions that can be spread if they're not treated.
Sure, and as so many of these conditions become more nasty. These bugs pick up virulence.
No, Affordable Care Act is a tremendous opportunity. It's a step on a road. We've been on that road since 1912 when Teddy Roosevelt suggested universal coverage, and we're going to reach. With the implementation of this, then we're taking another step towards what we really need, which is universal coverage for everybody.
How does Massachusetts? I mean, they're the prototype. How do they handle people who don't hire in? Do they, if somebody gets sick and shows up at the hospital?
Massachusetts is 97% covered. I mean, there's just not many people out there, so I'm not quite sure what they do with that 3%.
So all those freeloaders that Fox is hysterical about, just by and large, don't exist. I mean, it's just
they're not there.
Okay. Well said. Dr. James R. Kimmy, MD, MPH, St. Louis University College for Public Health and Social Justice. Sir, it's an honor and a pleasure to talk to you.
Thank you, Tom.
Thank you very much for being with us.